Assalamu alaikum, welcome to CaliforniaCare. Today we're going to make a short video about how to not only expand the arch laterally both ways, but also to expand it anteriorly without using any headgear. The key is that in case you're doing class 2 occlusion, in which you have retronaphia, you should be able to bring out the anterior maxilla, either maxilla or the mandible, very easily with this anteriorizing loupe. Let's take a look. So the idea, if you were to look at from the top, is that what you're trying to do is set up your wire so that you have about 2 millimeter gap from the incisal edges on the facial. What you will do is here you're trying to make the loop right here, so you'll hold on to this part, and then I'll go ahead and warm it up and make a loop right here, so the loop would prevent the wire from going posteriorly any further into the bracket than what it is. We would do this on both sides, then we'll end up with a loop here, one loop right there, and the arch wire away from the anterior teeth. So once we are done and we are able to engage the wire, it's going to pull the teeth forward. The idea is to hold the wire between the lips and the tongues of the hemostat and have them go into the inside of the gastrowave hemostat. That way this plane would remain level. We want to make sure the plane is nicely leveled. And then I'll heat up this area and then twist the instrument over. Heat it for me. Heat. Let's go heat it for me. Heat. Heat.
Pura loop, full loop.
Okay, when you look at it, make sure this plane is the same as that. It's important to keep them all in the same plane.
This is बिल्कुल ठीक है.
Okay. Now what we'll do is, without touching it in the hard end, you try it out onto the cast. See, the loop is preventing the wire from going any further. Now one thing you notice here is the loop has come down to the occlusion. So that's the wrong place for it to be. So this belongs not on that side, but on this side. The loop needs to go towards the gingiva. Where did we put that on material? Okay, let's focus the video later. So if you look at it, the loop won't go any further, the wire won't go any further, and this is not going to be the primary wire. The anteriorizing loop is not going to be the primary wire. It is going to be solely used to take the anterior segment and expand it facially. The same kind of loop is made on the other side, making sure the loop is towards the gingiva, and it would engage. And then once you have a primary wire inside, what you'll do is you'll go ahead and take this and tie it in the center. As you do this, the central teeth will come out, and then you can tie the lateral afterwards, next appointment, about a week or two, and then do the canines. And if the whole loop is squished together, you can expand out the canines, as you can easily see on the snap that the canine has a lot more space. So you should be able to laterally expand the canines too. And that's how you make the anteriorizing.
Can it be used to expand the premolars as well?
It would work, I think, till only canine. The best way to expand the premolars, excuse me, with the titanium would be with the regular wire, even main wire, arch wire. You would go ahead and hold it right there, and I'll demonstrate that as well. Let's take this wire out. So let's say hypothetically here is the canine. Let's double check that. So here's the canine, and I want to expand the premolars out. Heat, please. Right there. Heat, 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 heat. That's it. Right. So you see now there's an extra bend onto the wire. So if you were to take a regular wire and you put it like this, the wire would want to expand out the premolars and the molar. And we'll put it down here and you'll be able to see right there. If this is a canine, I would put it on the mesial of the canine. That way, compared to the left side here, you see that the premolars and the molar will expand out more. This would be extra useful in case you have a case where you have a cross bite or scissors bite in the molar region or the premolar. So if you were to put a bend here, mesial to the canine or exactly on top of the canine, then you should be able to easily move the premolars out and the molar out.
Yani expanding the wire on the premolar areas.
It would expand premolar area as well. It would help you with the molar.
Molars as well.
Night tie, super elastic night tie is only going to take shape if you heat it up. And once you have cooled it down, it has taken up the new shape. And that's how you can utilize it.
Okay.
Thank you.
Thank you.